On July 21st, Nanjing City, a city in China, reported 17 new positive COVID-19 cases. The briefing stated that routine nucleic acid testing by staff at Nanjing Lukou International Airport revealed that 9 samples from a mixed test were positive, all of which were airport cleaners. Further resampling and testing revealed a total of 17 positive cases. The Nanjing outbreak seemed to have flared up overnight. There were 405 flights scheduled to take off and land at Lukou International Airport on the 20th, and as of 11 p.m. on the 20th, 105 flights had been canceled and 151 flights delayed. A total of 17 people tested positive for COVID-19. At present, 9 of them have been diagnosed as confirmed cases, of which 4 are mild cases and 5 are general type. 5 people of them have been confirmed as asymptomatic carriers. The remaining 3 who were tested positive for COVID-19 are awaiting further diagnosis. As of 5 o'clock on Wednesday, July 21st, 157 close contacts of people tested positive have been traced. There were 56 secondary close contacts. Further screening is still underway. Immediately after that, Nanjing launched a full-scale nucleic acid test. Officials declared that in Jiangning District, the city's largest and most populous district, nucleic acid screening of about 2.4 million people was to be completed in the shortest possible time, with a certain degree of city closure, bus shutdown, and entry only. Closed management is imposed on people in medium and high-risk areas and on those in lockdown areas of the city. People who need to leave Nanjing need proof of a negative nucleic acid test within 48 hours, effective from midnight on July 21st. The difference between the sudden outbreak in Nanjing and other regions of China is that the Chinese Communist Party's media hasn't blamed it on sources abroad, but immediately admitted that it is a local case. Why is this? We will analyze it later. On July 23rd, an update was issued by the Nanjing Municipal Health Committee that on July 22nd, Jiangsu Province had 12 new confirmed local cases and 7 local asymptomatic cases. Among them, Nanjing had 12 new confirmed local cases and 6 new asymptomatic cases, most of which were workers at Lukou International Airport. As of midnight on the 22nd, Jiangsu Province has reported 38 cumulative cases of infection, including 23 confirmed local cases and 15 local asymptomatic cases. On July 23rd, the Nanjing Epidemic Prevention and Control Command reported that starting from July 23rd, the following parts in the city have been adjusted to be high-risk areas. There are also other areas that have been upgraded to medium-risk areas. On July 5th, the Nanjing Municipal Party Committee Secretary came to Nanjing Airport to inspect foreign-related epidemic prevention and control issues. He said, "The epidemic situation in foreign countries is still severe, and the main risk for us is still external import." 15 days later, an outbreak occurred at the airport, but instead of mentioning external import, it was directly acknowledged as a local outbreak in Nanjing. China's officials made this announcement to the public. Some analysts believe that this is because the location of the outbreak is at the airport in Nanjing. According to the official website of Nanjing Lukou International Airport, the airport is positioned as an important hub of a world-class airport group in the Yangtze River Delta, with routes to 78 major cities in China and 35 international and regional destinations, and completed 25.8 million passengers in 2017. If the CCP claims the outbreak source is a city or country other than Nanjing, which would direct the outbreak source to the airport, it would then be necessary for officials to track many passing passengers from numerous regions and even track foreign passengers. In the official briefing, 3 women, namely confirmed cases number 8, number 9, and number 3, worked as cabin cleaners and housekeepers of passenger planes, respectively. These 2 confirmed patients were engaged in passenger aircraft cabin cleaning and janitorial work, which means that they were in contact with the cabin of the passenger aircraft. During the cleaning process, they would have touched the seats and the apparatus and equipment on the aircraft extensively. Apparently, passengers and flight attendants traveling on the aircraft are at risk. However, the report provided by the Nanjing government seems to ignore this completely. Instead, it describes in length the trajectory of the patient's movements around Nanjing from July 10th to July 20th. For epidemic preparedness, it is usually appropriate to track passing passengers, especially those on passenger planes that the sick person has cleaned, on a case-by-case basis over the past 14 days. If this critical aspect is neglected, it is almost impossible to prevent the spread of the epidemic elsewhere, including outside of China. Of the other asymptomatic infections announced in the briefing, 2 worked as cleaners at the airport, 3 worked in ground services. Of the cases announced so far, at least 3 people have directly touched the aircraft's interior extensively. At least 2 people have touched the airport lobby extensively. It means passengers who have passed through the airport in the past 14 days are at risk. Theoretically, the source of the outbreak should be of 2 types. One is that there may have been a local outbreak in Nanjing a while ago, which was spread to the airport by people working at the airport, resulting in subsequent infections among aircraft cleaners, airport cleaners, and groundskeepers. Another possible source is that passengers from other areas flying to Nanjing carried the virus and stayed on the plane or in the airport lobby, infecting the aircraft cleaners or airport cleaners. In the second case, it is possible that the outbreak occurred in other parts of mainland China already, but has been covered up. The infected persons or virus carriers took the plane and brought the virus to Nanjing Airport. Currently, the CCP only acknowledges the Yunnan outbreak and claims that the previous Guangdong outbreak has been cleared. Information about the airport is quite limited at the moment. The official Chinese report only mentions that a total of 116,500 people were sampled in a few related critical groups in 3 areas. The airport has organized complete nucleic acid testing. All employees on duty wear isolation suits. Only some convenience stores remain open in the terminal. There is no mention at all whether past passengers at the airport have been tracked. Recent information on the airport's website also shows that the group's vaccination rate at the airport reached 90.87% as of May 12th, and it has been strictly implementing protective measures for employees in frontline positions and strengthening nucleic acid testing for key personnel to ensure zero infection. In an interview with the Chinese official media, YANGTZE, director of the Department of Critical Care Medicine at China Southeast University Hospital, said that the vast majority of these confirmed cases had been vaccinated, with only 1 case of a young person under the age of 18 not receiving the vaccine. The city of Nanjing, which had received the domestic vaccine on a large scale, announced in late May 2021 the 2nd dose of the vaccine entered its peak. Between June 10th and June 30th, the city focused on the 2nd dose, suspending the 1st dose. The resurgence of the epidemic has led the public to question the effectiveness of the domestic vaccine. As early as July 12th, a video showed that there were already people infected with COVID in Nanjing. A small percentage of Nanjing was locked down for management, and some areas had all personnel for nucleic acid testing. If the Nanjing government can skip the tracking of many passengers at the airport, does it mean a significant loophole exists in the prevention of epidemics? Is there something more severe that the outside world is not yet aware of?
We have to look at the epidemiological issues and all new cases actually popping up in countries, neighboring countries. The other thing, I think it's also very important is countries' capability in respond to the new surge of the COVID-19. So this is something we have seen in China, that when we have a small cluster of infections, then local government could respond very quickly and pull down, get that under control. So this is something actually the multiple factors should be put into the consideration.